Good morning, friends. Indian Academy of Orthopedic Surgeons is proud to present the 6th generation EBOO with UV irradiation of blood. 2 syringes are loaded with 3000 international units of heparin and mixed with 4 ml of water for injection. So 0.6 ml of heparin and 4 ml of distilled water are taken into each syringe, loaded and kept separately. These are the priming syringes and will be kept primed to the venflons of both the entry, that is donor, and the exit, that is the recipient site of the blood. As has been shown in previous videos, EBOO is extracorporeal blood oxygen ozonisation, and here 1 to 2 liters of blood is extracted from the patient, is infused with ozone, is irradiated with 243 wavelength of ultraviolet light and reintroduced to the patient. Now 2 venflons are introduced into the cubital foci. One for the donor site, one for the recipient site. This is a patient with polyarticular rheumatoid who was wheelchair bound and now has dramatically improved due to Mukherjee low dose DMARDs and multiple sessions of MAHT. This is his second session of EBOO. We try to introduce the largest venflon that the vein would accommodate. Here we are using an 18G venflon. The right side will be the donor site, and here we have locked the syringe, push the heparin in, pull it out to ensure that it is in the line, and now the venflon has to be fixed to the patient. You cannot wear gloves and use Dynaplast, and so this operator alone has to take out the gloves. The patient is wearing a charcoal mask for neutralizing the ozone. The left side is a recipient side, and once again a proper vein is located. And a venflon is introduced, and once it is in, the preloaded priming syringe is locked, little heparin is flushed, and blood is sucked to see if the line is open. This set is also fixed with adhesive plaster so that both sides are anchored. The 5 ml ampule has now 5 ml vial has got 19,000 units of heparin, which is now mixed with 500 milliliters of normal saline in a polythene saline infusion set, and the same is shaken vigorously to mix the heparin with the saline. This will be used to dilute the blood in a fraction just before ozonization so that it doesn't clot. EBOO set 1 is opened. The heparin part is attached to the heparin pipe, and the blood in part is attached to the Prakash Prasham Arul IAOS EBOO set. The set is very simple to use. This with a filter goes into the ozone bottle. The bulb without the filter goes into the heparinized saline, and the lure lock goes into the patient's venflon. The silicone part will go into the perfusion pump. So the bulb without filter is attached to the saline bottle. The stopper is closed. Heparinized saline is now hung to the stand. We now ensure that the length is correct, and the silicone part is introduced into the IAOS perfusion pump. The heparin is primed. The EBOO flask blood in port is introduced. The patient inflow clamp is opened. We now connect a 18 gauge needle to a silicone tube, bend the needle at right angles and introduce it into the ozone flask and begin ozone flow at 70 micrograms per minute with the regulator at 1/8 liter per minute by the IAOS Mark 5 ozone machine. Ozone out is attached to a waste collection bottle as the foaming and excess serum will be ejected out. The needle is bent at 90 degrees and pushed into the plus of the EBOO bottle. The plus part is connected to the stainless steel diffuser inside. The lure lock tube is now connected to the patient's venflon on the donor side, and then the perfusion pump is started, which will suck the blood from the patient and pump it into the EBOO flask. This EBOO flask is made up of borosilicate and it is a flint-free borosilicate that is 100% ozone compatible. We can see that the blood is being drawn into the heparin primed transfusion set and slowly rises into the EBOO bottle. The speed of the perfusion pump can be controlled to ensure that there is no collapse of the inflow tube. We can see the blood is being pumped in, goes through the infusion pump, raises up to the EBOO bottle and falls into the EBOO bottle. The UV lights are between 240 to 260 nanometers, and the same are now switched on to radiate the blood as it is collected into the bottle. We have to ensure that the EBOO flask bottle is 60% full before we start transfusing it to the patient. The heparin flow is regulated to have the barest minimum of heparin and ensure that the blood doesn't coagulate during the process. You can see that the perfusion is happening, and also see that when the bottle is half full, that is the right time to push the other transfusion set to the bottom of the EBOO flask so that the ozonated blood is transfused into the patient. We now have to open the outflow of the blood out and ensure that all air flows out. Once the set is primed, it is attached to the inflow of the patient, and at this stage we have to ensure that the blood into the bottle and the blood out are flowing at the same speed. You can now see the difference in color between the venous blood entering the EBOO flask and the purified, ozonized, cherry red blood which is going back into the patient. Even the patients are startled to see how much dramatic the color change is. The blood is being pumped from the top. Very small quantities of heparin are being added, and the ozonized blood is being retransfused through the recipient site. The therapist has to be on his toes during the entire therapy session, and the perfusion pump, ozone flow, ozone regulation, pump speed inflow speed and outflow speed have to be constantly monitored. The extra foam and the extra waste product, if any, will be bubbled out through the exit tube and is collected in a bottle separately. The UV light remains on. Perfusion pump, ozone inflow, blood inflow and blood outflow are constantly monitored and adjusted. It is preferable to have a 1/8, 1/16 or even 1/32 of a flow. The blood can be sucked at a rate varying from 10 to 40 ml per minute depending on the thickness of the venflon or butterfly that we have been able to get into the vein appropriately. The whole procedure to ozonize as much as 2 liters of the patient's blood should not take more than 25 to 30 minutes. You can see the startling difference between the input color and output color. So to repeat, the right hand is a donor. Blood goes into the perfusion pump. From there, it goes into the EBOO bottle. Ozone is perfused into the EBOO bottle, and the surplus or foam or the excess comes out and goes into a glass bottle. As this is a gravity dependent system, there is no need for air trap. This does not use any dialysis filters. Once the procedure is complete, we remove the tourniquet, switch off the pump, remove the set from the patient's donor site, and then we raise the set, the lower lock above the air level, and continue the pump so that all the remaining blood in the set is pushed into the bottle, all the while when the blood is being ozonated. Throughout the procedure, we have ozonized the blood with close to 70 microgram per ml of ozone, and once the entire blood from donor site is pulled into the bottle, we remove the silicone part of the pump from the perfusion set after switching off the perfusion set. The heparin is now closed and all the inflow systems can be removed and the set can be discarded. Whatever blood remains, which is about close to 100 ml, is now gradually being transfused to the patient at 40 to 60 drops a minute. The speed can be adjusted. If, as the ozone flow has now been stopped, we can remove the outflow pipe and later attach an airway from the top so that the air pressure is neutralized and the blood flows comfortably. So this is the ozone out tube, this is the ozone in tube which is removed, and now the ozone out tube is going to be removed, and the remaining blood in the flask is going to be perfused into the patient. You can see Dr. Arul in the background, who had come all the way from Chennai to join me in the procedure. The patient is very comfortable all throughout, watching the procedure with extreme curiosity and interest, and knowing well that within a day he is going to feel the dramatic effect of the procedure. We can monitor the patient by putting a cardiac monitor or a pulse oximeter. Important thing is, if you see the blood going in, it is bright cherry red and fully ozonated. This is a waste tube that has been discarded. The total amount of serum waste in the bottle is hardly 10 ml. We wait for the entire amount of blood in the bottle to be transfused into the patient, and once it is fully transfused, we can remove the bulb from the EBOO system, switch off the ultraviolet light and hold it higher than the bottle so that the entire blood goes into the recipient site. After this, both the venflons are closed. If the patient needs other intravenous therapies, one venflon can be retained while the other is removed. You can see the EBOO flask and you can see the bubbles of ozone inside it. This is a borosilicate flint-free glass. The transfusion set is removed and the venflon is closed, leaving the patient free to sit up. This is a message sent by the patient. The patient was bedridden and wheelchair bound before he saw me. After the EBOO, he drove 570 kilometers in his bike back to Chennai. If you want to learn more about the system and start using it, please message me at the above number. Thank you.